Hello, good evening, viewers, and welcome to your favorite medical show, Ask Dr. Saw. As you know, last week we had a live in studio discussion with Dr. Saw. Dr. Saw is back in England, but he's here again. Traveled last night, barely got in there this morning. It's pretty late there, I guess, right now. But he's very tired. But we're committed to do this show. And thank you, Dr. Saw, as tired as you are, that you're here committed to present this evening.
You're welcome, Akash, and I'm happy to be here. Indeed, of course, I think, as you rightly said we should maintain the momentum and continue the show.
Brilliant, Doc. When you're traveling and you're going, a lot of people, when they're traveling, before the travel, they sometimes they become anxious. Some people when they're during traveling, they're tired and all of these things. And tonight we're talking about hypertension and blood pressure. And a lot of times you find that when people travel and so on, say, man, it was so terrible. My pressure gone up, my pressure gone down. I want to start this evening by asking you, and this is something very, very, very common, hypertension and blood pressure. But I want to ask you this here. Hypertension and blood pressure, are they basically the same thing being used by different people, or is there that when you say hypertension and blood pressure, is there like a cutoff value to say you have gone past blood pressure? This is just a normal thing you use in at normal layman's term, but when you go to the hypertension, now you're in danger. Is that what it is? Is that what it is, doctor? And how should we? And what should be the target? What should be that target that lets you know that you've gone past, if that is the case, and if they're not basically the same thing? You're the doctor. Tell us.
All right, indeed. So I will give you some clarity in that. But before I go on, we have done hypertension in the past, but I thought, just came back from Guyana, and I tell you what, I think if this is a subject we can talk every week on, we would save so many lives.
Wow.
And so many morbidity. And simply, they say at a population level, if we were to just control blood pressure, it amounts to thousands and if not millions of lives. I mean, globally. Mm-hmm. Just by doing simple things, even a lifestyle intervention, just by restricting salt, let's say, for instance, we could save thousands of lives. And the reason why I felt that hypertension, we should address it again, there's so much of confusion, and even this has opened my eyes, to my recent trip, whereby there are lots of people are given blood pressure medication, but they're not achieving control. And not because you're taking something and it means it is working or it's adequate. You may eat and still be hungry. So if you're not having enough.
That's right. Yeah.
So
the
point is, like anything, like a disease condition, and if it is treated, it has to be managed properly. So I just want to give some clarity on that. Coming back to the point also in traveling, of course, if you lack of sleep, if you're stressed, the whole, just traveling by itself, you're late to the airport, you want to get here on time, you're anxious about flying, all these things can cause your blood pressure. Anxiety is a cause for high blood pressure. As a matter of fact, it's a very, very common cause. I get patients come in lots of times and say, Doc, I am scared of traveling. Can you give me something to, while I'm in the plane or something? And of course, I gave low dose of anxiolytic. So there are drugs like diazepam, low dose, 2 milligram. You use that, just before you go off to the airport, and it helps.
Keep it
and then you have that sleep disturbance. Mm-hmm. So melatonin is a drug you can use for that. So there are things we can do just to take away the anxiety and the stress of that. But come back to hypertension, targets, values, and what it is. So hypertension, hyper mean high, and hypertension is high blood pressure. But when you say, is blood pressure and hypertension the same thing? High blood pressure, everyone has got a blood pressure.
Yes,
if we don't have a blood pressure, we die.
That's right.
So generally speaking, you have to have a right blood pressure. When the blood pressure is high, it becomes hypertension, and that's a disease condition. You also have hypotension, that is HYPO, where the blood pressure is low. So HYPER is hypertension. Now the value that is given, it's a range of values. So you have what we call a systolic and a diastolic blood pressure. So systolic, when the heart pumps, it squeezes, it pushes blood, that gives you the systolic. It relaxes, the pressure drops, that gives you the diastolic. So, just for clarity, the systolic blood pressure, that's the top number. If you do the chart, you'll see it should be between 90 and 140.
Right.
The diastolic blood pressure, what is considered normal, right? Between 60 and 90. So you've got those two values. So in essence, if the blood pressure on top is greater than 140, that's defined as high. Or if the bottom number is greater than 90, that's the definition of high blood pressure. Now, either one could be high. That means you could be over 140 and the bottom number normal, and that is high. Or your top number may be normal, so you may be 140, and the bottom number is 95, for instance. That is over 90 at the bottom, and that is considered high. So yes, there is a target value. So you want to be about under 140 at the top, under 90 at the bottom. Ideally, I would say we tell patients, the evidence tell us, you don't want to just be at that borderline where you're 140, 90. If you're about 10 less, so you're about 140, 80 and under, that's probably your ideal blood pressure that you're looking for. And you should, try by all means, whatever it takes to get it to that level. It amounts to good health and decrease risk of cardiovascular disease, that is stroke and heart attack and, those sort of things.
Yeah, Doc. When you hear like I think I remember since I was small, the first probably disease that I heard about or medical condition must have been pressure. Everybody here talking about low pressure, high pressure, low pressure. I'm telling you that this is in the early 70s, So it seemed it's that has been people dealing with hypertension and hypotension has been it probably is age old as time immemorial, or as people became more unhealthy in many ways. But what is different from then and now is that those people that I used to hear from about in those days were old people who are talking about pressure. Most of them, a lot of young people these days are talking about blood pressure issues, hypertension, and in looking at causes, are there different types also of hypertension?
Yes, of course. So you rightly said it's usually a disease of old people, and you would know traditionally. But remember, now even the younger people are affected, but they still have the old people type of blood pressure.
Oh.
And that is because of poor lifestyle. So let me just, clear this up.
Yeah.
So you have high blood pressure. There are different types. We call it primary hypertension and secondary hypertension. So primary hypertension is the most common type. 95% of the population of high blood pressure patients, we say that that's primary. And primary means it's a multifactorial cause. There's no one cause. And the multifactorial meaning there's a genetic predisposition and there's some environmental factors and lifestyle factors. So you have a genetic predisposition, so it runs in family. And if the environment, let's say you're in a very stressful environment, you're not sleeping well, you're not eating well, you're obese, you're, all of these lifestyle factors, it can increase your chances of having high blood pressure. Now, that is your primary hypertension that affects most people. Then you have secondary hypertension. Secondary hypertension tells us that this is from another cause, a secondary cause.
Okay.
And of course, they're all treated differently and approached differently. So if you're looking for the secondary causes, which affects about 5% of the population, you're looking for things like the common secondary causes would be kidney disease. So people with kidney conditions, there's something called glomerulonephritis, polycystic kidney. There are lots of conditions of the kidney because the kidney has got a mechanism in itself that controls the blood pressure. So when we talk about management, I'll explain control and how it plays a role. So when you have damaged kidney, then also the blood vessel to the kidney, they've got some chemicals are secreted by cells along the blood vessel of the kidney. So if the blood vessel is too narrow, we call a renal artery stenosis, that can also cause high blood pressure. And then you have endocrine causes. So they're still all secondary. So these are the 5% I'm talking about. Um, Endocrine causes, patients who have got too much steroids in their body, Cushing's disease, something called pheochromocytoma, Conn syndrome. There are lots of, remember, our body has got chemical and hormones. And if you have excessive or a disproportionate balance, you can have high blood pressure, because blood pressure is controlled by the salt, the water in our body, our size of our blood pressure, the rate of the heart, and there are other factors that can control that. And those are your secondary causes. And importantly, also, there is pregnancy-induced hypertension. You know, pregnant mothers get high blood pressure.
Right, yes.
So that is another type of high blood pressure, which is pregnancy-induced. So you have, and then there's some drugs that can cause high blood pressure. Medication can cause high blood pressure. So indeed, you have primary and secondary, and the causes are different. Primary, multifactorial, genetic, and this is what is defined as the old people type of hypertension. But more and more, we are seeing young people with primary hypertension, and these are your obese, metabolic syndrome type of patient, lack of exercise, eating unhealthy, high stress level, maybe sleep apnea, loads of factors. They say if you find high blood pressure in anyone under 35, you should look for secondary causes. You have to rule out secondary causes. So I would go and investigate those patients. We will do some hormonal tests, and we will scan their kidney, because you can have some disorders around the kidney area that can give you secondary hypertension.
Brilliant. All right, Doc. You're holding up well as much as you're tired. I hope you didn't have to you didn't have to do a blood test after you're traveling, right?
No,
all right, good.
I'm good.
Right. Great. So viewers, remember, you can send in your questions. You can ask about hypertension. You can ask about blood pressure. You can ask you can ask on tonight's topic, or you can ask on any subject, and Dr. Saw will answer those questions next week. Dr. Saw, I know that blood pressure is fatal. Hypertension is fatal. But what are other complications? I mean, this is the end. This is like the end of it. It's like. But what are other complications that can be associated with hypertension or hypotension?
So we know that high blood pressure, so it is controlled by the blood vessel. The pressure in the vessel is what is measured. That's how you get high blood pressure. Pressure in the vessel is a component of lots of things. The blood is made up of liquid, so fluid, so water, that is. The blood component has got salt in it. You've got a heart rate, so the heart is pumping fast. The pressure goes up. The amount of blood that's pumped at one time. So these are all factors. And if you have high pressure in a vessel, I mean, like anything else, the pressure is high, the vessel can burst. So if the blood vessel bursts, you can have a stroke. So complications would be stroke. Also, the high blood pressure, over time, it causes inflammation of the blood vessel and damage to the blood vessel. Now, these are all inflammatory components that then can give rise to the pathogenesis, that is the cause for things like heart attack, buildup of plaque, blockage of the blood vessel, something called peripheral vascular disease. High blood pressure can contribute to all of that. It can damage the kidney. So, big on the complications of hypertension would be blood vessel, stroke, heart attack, peripheral vascular disease, kidney disease. It causes, they say the eye and the kidney, there are two organs that are commonly affected in high blood pressure. You tend to have bleeding in the eye sometimes. These are the vessels at the back of the eye. That's why when patients have got high blood pressure, the doctor would look into their eyes and you can see signs of bleeding.
Okay.
We also test the kidney. We check the urine. There are a couple of things you can get wrong with the kidney. You can have protein in the urine, which shows that the vessels are damaged. Also, you can have blood in the urine. So, hypertension itself, can cause complications in all the
Yeah.
blood vessels, and a big part of it is stroke and heart attack. We know you've seen patients with stroke. First question they will ask you: do you suffer with high blood pressure?
Yeah.
And when your pressure is high, the risk is fine. You can get a stroke. But there are different types of stroke. We probably do a topic next on stroke, where you have a stroke as a result of a blockage, or you can get a stroke as a result of a burst blood vessel. So like how you get a heart attack and you have a blockage and the plaques build up, cholesterol plaques build up, you have a blockage from a heart attack. Likewise, you can get similar with stroke and a burst blood vessel.
Brilliant.
So those are the complications.
Well, let's
And
see.
heart failure, I mentioned.
Yeah.
The heart also,
Go ahead.
just to clarify this point, the heart is pumping against high resistance. So if the heart is pumping against high resistance, the muscles get bigger. As the muscle grows and it gets thicker, it outstrips the blood supply.
Yeah.
And you don't have enough blood to the muscle can, you can get a heart attack. And after a while, it stretches the heart. So if the heart muscle stretches, it loses power to
Yeah, it doesn't have the same.
contract. Yeah, smoothly, yeah.
You know, like I listened to you talking about all this hypertension, and I'm thinking to myself, there are some people who would say, I just listened to doc talking, and I feel like my blood pressure gone up. Quickly, I want to ask this here. I mean, you spoke about anxiety and so on, but can somebody just hear something quickly and triggers, and then this thing, it could send your heart, your blood, it could send your blood pressure because your heart rate is increased and all of that, right?
That's correct. Yeah. So that is not a blood pressure proper per se. Meaning, I cannot say that this person has got high blood pressure just by you suffering from anxiety-related hypertension. So there is something called white coat hypertension. You go into the doctor to see the doctor, and your blood pressure is high. But when you're at home, you test it, and it is normal. So that is more an anxiety-related condition. So we would not classify that you're hypertensive. You've got white coat hypertension, we call that.
Okay.
And yes, if you hear bad news, if you suddenly anxious or scared, it sends your heart rate up. There's a chemical that is released in your body. You know, the flight or fight hormone.
That's right. Yes.
So you know, that sends the heart rate up, and it constricts the blood vessel, and you can have your blood pressure going up because of that.
Brilliant. I just wanted I just want to clarify that. Yeah. Lifestyle modification. You mentioned earlier about lifestyle modification. You said when you talk about management, you'll talk about this. So, quickly, Doc, what are some of the as much as we know the standard things that we should be doing in life, what do you recommend and reiterate that we should be doing?
All right. So, like everything else, I always try to talk about, let us look at non-pharmacologic. So pharmacologic means drugs.
Yes.
Right? Medication, prescribed medication. So I always try to attempt non-pharmacologic options for us. And the non-pharmacologic would be lifestyle modification. Let us look at weight management. Try to control your weight. If you control your weight and you lose weight, you tend to lose blood. The blood pressure tends to get better. We look at your diet. There is something called DASH diet. Is dietary approach, DASH, to systolic hypertension, something like that. Yeah, DASH diet. Dietary approach to systolic hypertension. I think if the acronym is correct. But okay, the intention there is increase fruits and vegetables, low fat dairy, high fiber. And that has been proven, DASH diet has been proven to help blood pressure. We want to cut down on your salt intake. So sodium intake. We want to exercise. So exercise is known to reduce blood pressure as well. So I emphasize, in previous episodes, I say you should aim for 150 minutes of exercise per week, moderate exercise. What else? You want to reduce your alcohol intake. There are other factors like magnesium, potassium, but the guidelines don't recommend specific supplement in regards to that. We know there are some things like garlic and what else? Beetroot and those sort of things. But again, there's no guidelines, recommendation for herbal management. But some people will tell you, I mean, I know indeed the chemical in beetroot, for instance, as the nitrates, and that can, it dilates the blood vessel and it can drop your blood pressure. But what we don't know how much, for how long, what is the kind of dosage. So you can't say for sure that, hey, have this and this is going to control your blood pressure. We would say, if you do the lifestyle things that we recommend, if your blood pressure is not controlled, then you should seek medical attention, and where we are going to prescribe medication.
Well, yeah. Well, since we're at that junction, doc, and I don't want to keep you too long. Why don't we then explore the pharmacological options? Right.
I really want to emphasize this, and I want to spend a few minutes on this. Really
brilliant.
Let this sink in strongly. I want a management of high blood pressure, because I tell you what. Nowadays, you have all these Apple watches and gadgets that you wear, electronic device, you can measure your blood pressure. So there's no reason why we can't measure our blood pressure at home and spend, $20 for a machine. A blood pressure machine on average is about $20. You get these electronic machines.
All of these pharmacies sell it across the country,
That's correct.
Yeah.
So they are quite accurate, most of them, once it's good brand. And so we know we can diagnose high blood pressure. So you test your blood pressure a few times. So normally I will tell patients, if you test it and it's high at one time, that doesn't mean it's high blood pressure. You have to have persistently raised high blood pressure. So if the pressure is continuously raised over 140 and top and over 90, you know you have high blood pressure. Then your approach would be, non-pharmacologic, and then we go to pharmacology, medication now. So lots of patients, and the reason why I want to emphasize this strong point, I have seen too many patients, even on my previous trip, just trip to Guyana recently. There are loads of patients coming to me. They are taking blood pressure medication. Blood pressure is not controlled. And when you talk to them, they say, I'm taking medication. I said, it's not about taking the medication. It's about taking the right medication at the right dosage and for the right period of time. And if you need to add another drug, you do that. So let us go through that. So there are specific guidelines. So as I say, blood pressure is controlled by different mechanisms of the body. Blood volume, size of blood vessel, heart rate. Let us look at those three components. Simple. So blood volume, salt level can control your blood volume. So there are a class of drug that will reduce, like diuretic, water tablets. They take away the blood volume. They make you pass urine more. You pee out sodium, that is salt, and water. So your blood volume constrict. Your blood pressure can go down. The blood vessel size. There's a class of drug called calcium channel blocker. A typical example, amlodipine, nifedipine, larcanidipine. They dilate the blood vessel, expand the blood pressure. And we know, like a pipe system, if the pipe is narrow, pressure is high. If the pipe is big and relaxed, pressure is low.
Right.
That's common.
Yes, that's right. Yeah.
We all practically experience. And then you have heart rate. You can control the heart rate by controlling blood pressure by controlling the heart rate. So the point I'm making here is that you have drugs. All drugs are not the same. They do not work the same. The dosage is not the same. Because patients would come to me and say, Doc, I'm taking 5 milligram of one, and I'm taking 100 milligram of the other drug. Why am I taking 100? Well, 100 is working differently from the 5.
Right.
So you can't compare them. These drugs, they work in different parts of the body. So there are special guidelines. What we do with high blood pressure, we start with one drug, first drug. So we'll start at a low dose. If the blood pressure is still high, we go up to the maximum dose. So let's say we start common drug to start with. There's a class of drug called ACE inhibitors. That is ramipril, lisinopril, captopril, or ARB, angiotensin receptor blocker. Common drugs with losartan. They work similarly. So these drugs, they work in the kidney. So lots of people also read and they say, if you have kidney disease, don't take it. and they get worried. Don't get worried, because these classes of drugs, they also help the kidney.
Okay.
So you have to take it in context. If you're concerned, then talk to your doctor will explain that. So we usually would start, that's a common one to start with, or another one called calcium channel blocker, right? You want to start with that first. You start low. If you test the blood pressure, it's still not controlled, you keep increasing the dose until you reach the maximum dose. If the blood pressure is not controlled, you do not stop that drug. You add a second drug from a different class.
Mm-hmm.
So you can't add a second drug from the same class, because I've already reached the maximum
yes.
dose of that class of drug.
Yeah.
This is another mistake I've seen sometimes. Patients, I don't know who is at fault there, if the patient or the doctor, but they end up taking double dose of a drug that really, it reaches the maximum dose already.
Mm-hmm.
You can't just take 2 tablets if the doctor did not say take 2 tablets, because you may already have the maximum dose, so it can cause more damage. So you have to take from a second class. Then we go start low again from the second class, maximum. Then we go on to the third class of drugs, fourth class, fifth class, like that. Normally, by the time you're about 4 classes of drug, so the common classes would be ARB, that is lisinopril, or ACE inhibitor, or ARB, lisinopril, captopril, losartan. Then you have what we call calcium channel blocker, amlodipine, nifedipine. Then you have a diuretic drug, thiazide diuretic. Then you have spironolactone, is another, we call it MRA, but diuretic effect as well. And then you have drugs like beta blocker, that slows the heart down, atenolol, bisoprolol. I just name a few so patients know what they're on.
Right.
So they will say, right, I'm taking 2 drugs, from different classes. And we do a combination. People sometimes get worried. They say, why am I taking 2? Why can't I take 1? Some evidence tell us sometimes you have better control if you take 2 half dosages.
Okay.
So you could take,
gotcha.
From 2 categories.
Right.
Because you're attacking the system from 2 directions.
Mm-hmm.
And some people, combination therapy works better for them. Some people, just using 1 tablet, reaching the maximum dose, works better for them. Whichever works for you, the most important thing, you have to have good control.
All right, great. Doc, thank you so much for making this time available to do this with us. I know you're tired. We wish you a good night's rest. I know you're probably back in the clinic from tomorrow already. But
absolutely, yeah. Normally, once I go away and come back, full clinic is always booked in advance. Yeah.
Brilliant. All right, well, viewers, thank you so much for joining us tonight. As usual, Dr. SAWH will be answering your questions from this week, next week. Is there anything you'd like to say in closing, Dr. SAWH?
No, thanks again, Akash, and I'm happy again to continue our program. And the most important thing, the take-home message for high blood pressure is, even though you take tablets for it, just measure it and ensure you're within range. Your target is met. So again, up under 140/90. If you've had previous stroke and heart attack, you should be under 130/80. 10 less. But yeah, that's a take-home message. Aim for good blood pressure control, and you'll prevent lots of, mortality, morbidity.
Brilliant. Well,
Thank
viewers,
you and good night.
Yeah. Well, viewers, thank you so much for joining us this evening live here on the Guyanese Critic platform, TBN Studios, and on my page, Akash Prasad. Also, you can also follow Dr. SAWH on his Facebook page also. And remember to stay healthy and to stay connected with us. We will see you next week. Have a good night and a great week until we see you again next week. Bye.
Good night.